41 weeks. You're a week past your due date. I'm sure you're pretty miserable and you're excited to see this baby. But the baby is coming any time now. At 41 weeks, generally this is a time when we like to induce labor. And the reason is, once you get past 42 weeks, once you hit that 2-week mark past your due date, we know that there's a significant increased risk of the baby. And the reason has to do with the placenta. The placenta is not really designed to last really that much beyond 41 weeks. And so by 42 weeks, the blood flow to the baby isn't as good as it was earlier. That can mean that the baby doesn't have as much reserve, it's not getting as much nutrients and oxygen, it can decrease the amount of fluid around the baby. So you really don't want to pass that 42 weeks mark, that 2 weeks past your due date mark. And so at 41 weeks, it's really generally time to induce your labor. Now, one of the things that may be done at 41 weeks is something called an NST, which is a non-stress test. And that's where you'll be monitored, where a little disc thing will be put on your tummy that monitors the heartbeat of the baby. And that's generally done for 20 or 30 minutes, and we look at the pattern of the heart rate on that monitor, and we can look at the pattern and be assured that the baby is doing okay. If the pattern doesn't reassure us, it doesn't mean there's a problem, but it probably means that it's time to be delivered. So 41 weeks, your doctor's probably going to set you up for an induction. There are a lot of different ways to induce labor. Sometimes we use Pitocin, sometimes we use prostaglandin agents such as Cervidil or Cytotec. Lots of safe alternative and different methods for inducing labor, but really you want to think about getting your labor induced because you really don't want to go past that 42-week mark. So 41 weeks, probably a little disappointing for you. You thought you'd have your baby by now, but any time now the baby's coming and you'll be done with your pregnancy.
Medtwice.com